So that would be great. Well, by my watch, it is 6 p.m. So I'm sure we will have people joining us as we go along. Normally, welcome to the March meeting of the League of Women Voters of Greater Birmingham. My name is Dana Ellis, and I'm the current Vice President. Leonette Slay, who is on with us tonight, is the president. She had texted me and said she's having some internet issues where she is. Normally she opens with some announcements, but doesn't have any tonight, so asked me to just start. I will open with one announcement and let you know that our April meeting, which is only a few weeks from now, it's April the 8th at 6 p.m. Our speakers will be the co-chairs of the League of Women Voters of Alabama advocacy team, who will give us an update on the state legislature, particularly as regards to the issues that the League is advocating for. So I know that's going to be a great meeting if you want to mark your calendar tonight, April 8th at 6 p.m. Our topic tonight is homelessness in our community. And for those of you that this might be your first meeting, what we normally do is our three panelists will speak. We'll try to hold questions unless it's an absolute burning question until the end. So, and then have all of the questions at the end of the panel discussion. And I see that Jean has put the registration link for the April meeting in for anybody who wants to go ahead and register for that. It too will be on Zoom. So I'm really excited. We have three great panelists tonight, all of whom work in the area of homelessness. They will discuss with us the issue, how their particular agency works, and then what we can do to help. We'll have a question and answer period at the end. Jean, April 18th, is that another meeting?
Excuse me, let me check that.
Okay, great. All right.
I'm trying to figure out how to delete that text to it. So
okay,
I'll get the date straight and send it again.
That's great. So let me start first by introducing Valencia Green of Firehouse Ministries. Valencia is the assistant director. She's been working with the agency since 2011, when she began as an intern for her work for her social work degree. She graduated with honors from both UAB in 2011 and the University of Alabama in 2013, with bachelor's and master's degrees in social work, and obtained her master's license in 2017. She also sits on the One Roof Continuum of Care Board of Directors. She's worked at Firehouse as a shelter program assistant, a transitional housing case manager, a housing program coordinator, and now the assistant director. Having worked these various positions, she has specialized knowledge in working with the homeless population and the complexities within the community that can hinder persons from moving out of homelessness and into housing and income stability. She believes strongly in work-life balance, and when she's not working, she loves to spend time with her husband, her cats, her family, and friends. So Valencia, I will turn it over to you. I doubt there's anybody who's new to Zoom in this day and time, but just in case you don't know, you can change your view to speaker so that you will see Valencia mainly when she speaks. Okay, Valencia.
Well, good evening, everyone. Thank you all very much for inviting me to participate in this panel to discuss homelessness. So Firehouse Ministries has been around for more than 30 years now, helping the homeless men in Birmingham and Jefferson County. Some of our core values that we give to our clients is treating our clients with dignity and respect. I'm understanding that they are able to self-determine what their goals look like, what needs they have that need to be met. We understand that our ministry is just one part of the larger community, and we collaborate with our other agencies to provide those resources to get folks out of homelessness into secure, stable housing and stable employment. But our main goal is making sure that our guys have a place, a safe place to be while they're going through their issues. There are many issues that bring persons to homelessness. The main core ones that we deal with are substance abuse issues, mental health issues, and just plain run-of-the-mill, someone lost their job or separated from their family. And so they need a safe place so that they can regroup. Here at Firehouse, we offer several different programs. So our main program is, of course, the shelter program. But we also have a soup kitchen, which is our feeding program, where we offer 4 meals a day. So gentlemen who live here and stay overnight, they get breakfast and dinner. But for the community and the street homeless or the working poor, we also have a lunch and we have a snack. Now, prior to COVID, those street homeless and the working poor will be able to come into our shelter and take advantage of our meal program and also our day shelter, where they could come in, get a shower. If they want to use us for, use our address for their meal, use our clothing closet, get showers. But right now, with the pandemic going on, we're limiting the number of persons who come in at one time to get those services, but they are still offered. Our other program is a pre-substance abuse program. We have great relationships with treatment centers around the county and around the state, where when guys are ready to do something or address their substance abuse issue, they can come to us, and we have a team program where they can be in a safe environment while they're waiting for their bed to become available to go off to treatment. We also have our clothing closet, like I spoke of earlier, and that runs about 3 days a week. But right now, while we're in COVID, it's going every day so that we can help more people and not have a bottleneck of folks coming through. We also have our GED and our tutor program. One of your lovely members has been a long time volunteer with us, Miss Nancy, and she helps get our guys ready to take their GED, and also our staff, because we all sometimes need to, you know, brush up on our writing skills. So she's been quite the gem in our program. Other things that we offer workshops, things like literacy, life skills. We have nurse OTs that come in, OT students that come in, to help our guys, because sometimes just learning how to play a game. You know, we're always asking our clients, when are you going to get a job? When are you going to get your driver's license? Have you been to the doctor yet? Have you been to counseling yet? Which are very important things to get one back up on their feet, but also just learning how to just breathe, just be able to sit with yourself, be able to interact with your peers. Because a lot of times our guys are chronically homeless. They've been on the street a long time. And so what they know is how to be aggressive in how they're asking for things, because they've been told no a lot. And so just being able to, in tandem with our OT students, to just be able to learn how to play a game and to interact. One new program that we have is a fine arts program. So this was born out of the OT students coming, and the fine arts program helps the guys to be able to express themselves through art, being in a safe place where they can get vulnerable about how they came to be here at the shelter, and then giving them the opportunity to grow out of that and to be able to sit with some poor decisions they may have made, or some decisions that were forced upon them that they have not yet worked through. And so that's the gist of what we do at the shelter. But the biggest part is working with our agency, our community partners our agency partners out in the community to make sure that we can connect folks with the resources that they need to end their homelessness.
Thank you so much, Val. And as I said, we're going to hold questions till the end, but that was a great amount of information. For those of you that may not have seen it in the chat room, Gordon has thoughtfully placed the website address for the Firehouse Shelter for those of you that would like to learn even more. But I will ask you one question before I move forward. What kind of help and support can we offer? What's the best way for the community to support the Firehouse Shelter?
So our clothing closet is our biggest need. We are always in the need for undergarments, t-shirts, tank top t-shirts, socks, belts, those type of things, toiletries, soap, shampoo, lotion. Those are the biggest needs that we have, that we run short on. Cleaning supplies so that we can help keep our shelter clean, especially in the time of COVID-19, hand sanitizer, things like that, and also meals. Since we do feed 4 times a day, preparing meals is very important. So we will feed right now about 100 people a day, several times a day. But hopefully after, the vaccinations and the vaccines get out, we usually will feed up to about 200 people several times a day. So sack lunches are always a good thing. Water, meals that are made and prepped and brought in, and we just warm them up and feed. Because we're not letting everyone into the shelter right now, we are feeding our street homeless in front of our building. And when the weather is bad, they're able to come into our chapel. So being able to give them a sack lunch is very good for the agency.
Great. Thank you so much, Val. Our next speaker is Carrie Lee Leland. Carrie is the executive director of Pathways. She began her career 23 years ago working with women experiencing homelessness and victimization. She's a passionate advocate for women's issues and Pathways' mission of empowering women on their paths out of homelessness. Carrie received a bachelor's degree from Judson College and a graduate degree in public administration and nonprofit management from UAB. In 2020, she was named an outstanding woman by UAB's Commission on the Status of Women. So Carrie, we're looking forward to hearing from you next.
Thank you. I'm excited to be here and tell some of you more about Pathways. Pathways is 38 years old. So many of you may feel like you know a lot about Pathways because we've been around for such a long time. We're one of the oldest women's shelters in Birmingham. We were one of the first to start providing services to women through our day center. And we still operate our day center, which is a daytime emergency shelter for people experiencing homelessness in Birmingham. And some of the things that our day center offers is going to be similar to what you heard Val talk about at Firehouse. We offer showers, laundry, meals, access to computer and telephone, access to clothing and hygiene products, access to a social worker to do case management pieces toward ending homelessness. One of the things that the day center offers, which I think is the most charming thing to me about day center, is we are the permanent home address for many of the homeless women in Birmingham. People come to day center to pick up their mail. You can't do anything in life without an address. Think of how many times you have to go fill out something and put down your address. And Pathways, 409 Richard Arrington Jr. Boulevard North is the address for many homeless women in the city. And sometimes we see women come by and they check their mail. And not only are they checking their mail, but we get to check on them. So So I always say, if they just come by and check their mail once a week and catch up with us, what a tremendous service. So one of the things that I love most about Pathways is we are the home address, the address of record for many of the city's homeless women who live on the street and in nearby emergency shelters. One of the things about the Day Center is we are relational with our clients. We know them by name. We know what's up with them, what they need. Can you imagine what it's like to be homeless? Sometimes you're invisible. Sometimes you're avoided. Sometimes people kind of walk around you or purposefully avoid crossing paths with you. We want to cross paths with homeless women and children at the Day Center. We want to cross paths with homeless people. And so one of the services that we provide that is just warmth to me and warmth to the clients is, where have you been? How are you? We haven't seen you in a couple of weeks. What's going on with you? It is truly a sense of connection, and people need to be connected to people. I don't care what your issue is or how you got to your station in life. You deserve to have someone ask you how you've been, if you're well, and just let you know that you're thought of. We are some of the only people that know the birthdays of the street homeless and are like, hey, happy birthday to you today. You know, I'm so excited that you were born. You have no idea how affirming it is to someone, no matter what they're going through, to let them know that you are glad that they were born. And so if I could tell you in summation what our Day Center is, that is 38 years old this year, our Day Center is hospitality and our Day Center is hope for people who don't receive a lot of either in their daily life. And so I'm very proud of the Day Center. It's our oldest and core program. There was a group of women 38 years ago who got together and said, we need to provide this service to homeless women. So never underestimate what a group of women such as yourselves can do in the lives of other women in the community. The other thing I want to talk to you about is our emergency shelter program. We have an emergency shelter program called Stepping Stones. Stepping Stones opened in 2019. I came to Pathways in 2018. We had some programs, we had some space in our building that was available for a new program. And I thought the best use of that space was an emergency shelter. And so we started Stepping Stones, which is an emergency shelter that holds 24 women and children who are homeless. We can take families. One of the unique things about Stepping Stones is we can take larger family groups. We have some rooms that are set up for women who have multiple children, 3 or more children. Sometimes it's hard to house a woman who has several children in her care in a smaller shelter space. And so we have some specific spaces in Stepping Stones for larger families. We don't have any age limit on boys. I am the mother of 2 grown sons now. I would have absolutely slept outside with them if we couldn't have come into shelter when they were 12 or 13 or 14. We do not separate families, so we have no age limit on boys. That's another thing. I believe that children need to be with their mother. I think that that's an important role in children's life. I think it's important to empower mothers. I think mothers can be the leader of their homes. And if you've ever been through anything as a woman, you know, sometimes we are the ones that have to get it back together and get the show on the road and just get the family back on track. And I've had to do that in my own life. And one thing that we focus on Stepping Stones is empowering women to be the leaders in their family, whether it's a household of 1 or a household of 7. People can do it, but they can't do it alone. And so Stepping Stones allows women to stay for up to 9 months. We've been extending that stay during COVID because we're not going to kick anybody out who doesn't have a place to go, who's not ready for housing. So we have some people who have been with us for longer than that because they were there when the pandemic hit and so many things slowed. But one thing I would tell you about Stepping Stones, to sum it up, is when a woman comes in, whether she's by herself or has children in her care, we look at her situation in life and we make a case plan that is focused on removing the barriers that are keeping the family in homelessness. There are absolutely barriers that keep the family in homelessness. And I'm going to talk to you a little bit more about those barriers in a minute. Our other program is called Safe Haven. Safe Haven is one of our older programs. It was born in 2006. We have a Safe Haven for women. It has 10 beds. And it houses women who are experiencing homelessness who have a mental illness diagnosis. We have a priority for women who are chronically homeless in that program. So that means they've had multiple instances of homelessness in a period of a couple of years that can't be resolved. So the women who live in our Safe Haven program typically tend to be older. They typically tend to be over 40 and have a mental health diagnosis that is significant, where that mental health diagnosis is contributing to their homelessness. It's one of the factors. Some of the people who come in our Safe Haven program have been unsuccessful in an emergency shelter setting. Safe Haven is a home-like environment. Everyone has their own room and a key to it. It is their space, and we do not have an expectation of when they transition out. So whereas Stepping Stones does not have the requirement of a diagnosis of mental illness, and it has a kind of a timeline on it where we work to transition you out. When it comes to Safe Haven, we do not have that timeline. It is an intensive program that is staffed 24 hours a day, and we really work with our women to stabilize them both on their medication, to build a sense of community that a lot of time is lost amongst people who are living with homelessness and mental illness, establish a sense of relationship again with their family, with whoever their support system is. So even though we don't have an expectation that people transition out, we do have people who successfully transition out of Safe Haven. That is a 10-bed program that serves about 16 women a year. I would venture to say that some of the most vulnerable members of the homeless population are women who are older with mental illness. We do know from our research and from talking with our clients that women who are homeless are more likely to be sexually assaulted than women who are housed. Women who are homeless are more likely to be physically assaulted than women who are housed. So we can never lose sight of the fact that we have people who are homeless who are suffering. Sometimes we have a narrative in our head about whether people deserve their homelessness or not, or the reasons that they're homeless, or that they want to be homeless, or that somehow they must enjoy it. You know, that kind of thing. I've heard all kinds of narratives over my 23 years working in this field. And I can tell you that the narrative that is true is that homeless people are good people. They desire the same positive outcomes in life that we do, and sometimes they face the worst injustices. So homeless women are victimized at a higher rate than housed women. And I think as women, we should never stop advocating for our sisters who are homeless, who are experiencing things that we as housed women are not, because we're protected by the structure of our homes. We are not vulnerable laying on the street. We are not hoping that someone comes by and puts some services together or protects us or that kind of thing. And so I always, when I talk to women who are not experiencing homelessness, want to point out that as women, whether you're passionate about homelessness or not, you are qualified to be an advocate for homeless women who are experiencing harsh realities of homelessness out there, because their life experience is very different than ours. And how would we handle it? And I always challenge people, when you see a homeless person, judgment should not be the first thing that goes through our mind. The first thing that goes through our mind should be thankfulness, one, for the provision in our own lives, and then two, how do we insert equity into the situation so that this person doesn't have to be homeless anymore? I would say judgment, if that's the first thought, that's the wrong conversation to be having with yourself. The thought should be equity. How do we lift this person up so that they have the same things that we do in our own lives? I always question the motives of people who want less for other people than what they have in their own lives, which is provision. Something that is just a need, particularly for women, is access to childcare. I don't care if you are the CEO of a company, or if you are an hourly wage worker, or if you are homeless. You need access to childcare if you have children, to be where you need to be doing what you need to do for your day. And that is something that is unilateral between a woman who holds the top position in the city, or the woman who is homeless and hoping to have a position of employment in the city. You need someone to help you with your dependent children so that you can be where you need to be doing what you need to do. And so one of the things that Pathways has been working on for 2 years, and this has been a huge undertaking, and there are times I've thought I'm absolutely crazy for even fooling with this. And we are establishing an early learning center. It opens in May of this year. It got delayed 1 year due to COVID. But the Early Learning Center at Pathways is called just that, Pathways Early Learning Center. And it will serve homeless children exclusively, which means if you are not a homeless child, we cannot serve you. So it will serve homeless children exclusively. It is low barrier childcare. It's immediately available to any homeless child in the city, whether they live outside, whether they live in a place not meant for human habitation, whether they live at Pathways or another shelter. So it is for homeless children, irrespective of where they live or what shelter they live in, birth to 5, and it is free of charge to the homeless family and immediately available. Now, the reason I'm excited always to talk about Pathways Early Learning Center is when it's a pilot project. We have not done free childcare exclusively for homeless children many places in the nation. So it's kind of a pilot idea to provide low barrier childcare at zero cost to homeless children, just for homeless children. But one of the reasons I think that it's so important is not only will it provide a safe and nurturing place for homeless parents to leave their children where they can have the peace of mind to know that they're well taken care of while they take action steps to lift their family out of homelessness, but it will also provide a environment designed just for homeless children. It is their environment. They can touch everything in it. Everything is tailored to them. So it will provide a respite from the realities of homelessness for homeless children who find themselves mostly in adult congregate situations in shelter settings. It will provide an opportunity for the child birth to 5 to stay with us at the Early Learning Center and have high quality early learning opportunities while mom or dad goes to the appointment to maybe get services or housing or whatever. There's a lot of appointments when you're homeless. You got to go over here and talk to somebody about this and go over there and talk to somebody about that. I always say there's a lot of hustle in being homelessness. There's no lazy in homelessness. You need to show up for appointments and put plans together for yourself. And so isn't it better for children to be in an early learning environment with qualified professionals teaching them and taking care of them than on the laps of parents at these multiple appointments or following their mom around or their dad around through town or through the park as they go to access services? So one of the things about this is sometimes childcare is looked at as a reward for the parent. We set goals for parents and say, if you get a job or if you do this, then we're going to provide you with childcare. What I say is, why don't we reframe the conversation and say, early learning opportunities are not a reward of the parent, they are a right of the homeless child. Homeless children in Birmingham are accessing early learning opportunities that are federally funded at a rate of 3%. The national average is 9%, and we are at 3% in Birmingham. I truly think Pathways Early Learning Center is going to get that percentage up because it is immediately available and it doesn't cost anything. You have to be homeless to come, so you're not competing with people who aren't homeless for a spot in our center. But I think that early learning opportunities are a right of the child and not necessarily a reward of the parent. And I think that we will start changing the way children view themselves, homeless children view themselves. I think that it will be a place where you are not homeless. You are just 3 or you are just 4 and you have the wiggles and you are there with your friends and you are learning, and we will start sending homeless children to school better prepared for school when they are public school age. So Pathways Early Learning Center is what it is. But what it's going to do is it's going to transform futures. It's going to transform possibilities. And I don't think we can measure the impact of that. And the last thing I want to say is I want to indoctrinate all of you as ambassadors for affordable housing. The answer to homelessness is housing. I don't care if you make $0 a year or if you make $12,000 a year or 20. You can make a low fixed monthly income. You can make a low wage or you can make no wage, and you still need housing to end your homelessness. We have several women that we serve who are low wage, minimum wage, hourly workers, and there is not housing that they can actually access because it doesn't exist as an affordable option for them. So we have women who are homeless because they don't make enough money to have housing. These are women who are working. How horrible is it that working people can't find housing? People who are on low fixed monthly incomes can't find housing. People on no incomes can't find housing. I believe that people have the right to housing. And I think that that is the message that we need to come together on. And we can all go out and go forth and work on that problem. And that is, people deserve to be housed. It's better for our community. It's better for the person. It's just better for everybody. And it is inhumane to sleep outside. And so, one of the things that I want to do with my life is communicate that to people who are housed, that we need to start thinking about the humanity of housing for people who cannot afford to be housed for whatever reason. A living wage is part of that conversation. And so that's another topic within housing. But you are all smart, successful, bright, connected in your communities. You are obviously interested in what's going on around you because you are part of this group. And so I would say those are the topics that you can take up as advocates in your spheres of influence that will help us as homeless service providers lift people out of homelessness. And that is my time. And I thank you for listening.
Thank you so much, Carrie. I know we're all learning so much from both you and Val. Our last panelist is Gordon Sullivan. Gordon is the operations director for One Roof, the homeless continuum of care for Jefferson, Shelby, and St. Clair counties. He oversees One Roof's day-to-day fiscal and programmatic operations. He's got over 6 years experiencing managing continuum of care and emergency solutions grants programs. Prior to One Roof, he worked as a national technical assistance provider for the U.S. Department of Housing and Urban Development. In that capacity, he helped to develop and shape program guidance for homeless service providers and continuums of care across the nation. He's got degrees in sociology and psychology from the University of Southern Mississippi and a master's degree in public administration with a focus on nonprofit management from UAB. Brian has put Pathways website in. So Brian, unless you have it pulled up, I'll search for One Roof's website and put it in the comments while you're talking. Thank you. Welcome, Gordon.
Thanks so much. And yes, I am that person that just puts a bunch of links in the chat box.
No, it's great. I love it. I love it.
Well, I just want to start today by saying thank you all so much for having us here to speak with you guys today. I see a lot of familiar faces and names here in the audience. I'm so glad to see all of you guys. And so glad that y'all are centering this issue of homelessness in our city and in our counties. It's a very important issue and one that we just don't think gets enough attention, right? So thank you for the lovely introduction. I am Gordon. I work with One Roof. One Roof's mission is to equip and empower our community to end homelessness as we know it today. And we do that through a number of different programs, centering around advocacy work, education, and also coordination of services. As mentioned in my introduction, One Roof is what's called a Continuum of Care organization. That is a designation that the U.S. Department of Housing and Urban Development, or HUD, gives a particular agency in a community. It essentially says, they are going to be the coordinating body of services that are going to be provided to folks experiencing homelessness. I want to piggyback on what Val mentioned earlier and also what Carrie hit on too. Both Firehouse and Pathways are member agencies of One Roof. So they join 45 other partner agencies to form a sort of coalition of agencies that are trying to address homelessness. And within that coalition, each of our agencies and each of our partners have a different sort of focus, right? So Firehouse Ministry is focusing on chronically homeless men primarily. They're also getting to the areas of youth homelessness and respite care too. And of course, Carrie's agency at Pathways has a different focus, still on homelessness, but focusing on women and children. So what do we all do that? So we want to make sure that everybody's sort of collaborating together to reach one goal and one mission, and that's to end homelessness. So to explain what a continuum of care is, that is what it is. It's just a coalition of folks and agencies and even municipalities like the city of Birmingham and Jefferson County, all coming together to make sure that we are providing services to meet the needs of the community. With that, I want to go over a little bit of some programming that One Roof does. And then I'd like to hit on a lot of like the state of homelessness. I feel like that's a question a lot of people are asking right now. So I'm going to have some data for you in just a moment on that. So at One Roof, we basically do 3 categories of things: advocacy work, education, and coordination of services. So with advocacy work, we try to focus on advocating for as many federal funds in dollars to come into our community. A fun fact, every single penny that comes to the state of Alabama that is aimed at addressing homelessness is a federal penny, right? So we have 0 investment from the state of Alabama and 0 investment from local municipalities to do homeless work, right? And that includes any type of homeless work, from street outreach to affordable housing to any of that. We rely 100% on the federal government for that. So each and every year, One Roof helps to bring together applications for funding. Annually, we bring in about almost $10 million in funding through the Continuum of Care program from HUD. Those funds go directly to our partner agencies like Firehouse and Pathways to do the programming, right? So we're sort of like the behind the scenes people who are writing grant applications and getting things submitted on time and reports done. And then the money goes to our partner agencies. So we sort of serve as a supportive role in that way. Next, we do a lot of education programs. We love talking to folks, whether it's folks who are school-aged or adult groups that are wanting to advocate for homeless issues. We do some programming around simulation type stuff, so like an interactive activity in which folks can really begin to better understand the challenges and barriers that folks experiencing homelessness have each and every day. So we have a slew of different kinds of education programs. One of those is a Cardboard Connect event, which we just had virtually, which was a little bit strange, but we did it. It is an event for school-aged kids and youths from 13 to 18. It's typically an overnight event where they get to meet folks who are actually experiencing homelessness through a panel discussion. We did it virtually this year, which again was a little strange, but it worked. It's fine. And we also do annually, some of y'all might be familiar with Project Homeless Connect. That is a one-day event where we have all of our partner agencies together in one space. It's thousands of people. Obviously, we didn't do that this year. I'm very sad for that, but we are looking forward to 2022 and having that event back up and running. Finally, I think most of our work falls under the coordination of services. Through collaboration, through our coalition of 45 different partner agencies, we try to do things like make sure duplication of services is not happening. And basically, we want to make sure everyone's playing nice together, right? So we are like bringing everyone to one table to discuss services and make sure that the needs of folks experiencing homelessness are met, A, and B, that agencies aren't doubling services, right? We want to make sure we're very efficient with the federal funds that we do have for programming, right? In addition to that, One Roof acts as a connector for folks experiencing homelessness. We have a 4-person street outreach team that does provide direct services and case management to folks who are living outdoors. So we go out and try to identify and engage persons who are least likely to access services. So we're talking about the folks that are not going to go to Firehouse Shelter, are not going to go to Pathways or any of our other partner agencies because, they're self-sufficient. They're living in a camp. They are, accessing services, but they don't want to come indoors, right? So we send our street outreach team out to those folks to just try to start building a rapport and trust with them. And through that, hopefully connecting them into existing permanent supportive housing programs through our partner agencies. So very much in that way, we try to connect folks from the identification of a need for housing and then actually moving into housing. All right, let's see, I'm looking at my notes here. So with that, I do want to switch gears a little bit and start talking about the state of homelessness. So one of the most important things we do at One Roof is we help to collect and manage data on homelessness. This data is used to help us determine how well we're doing towards ending our goal of ending homelessness. We do an event every single year called Point in Time. Many of you might be familiar with this already, but it's essentially an annual event that happens every January in which we go out and we survey. It's kind of like a census style survey of everyone who's experiencing homelessness that we can find and engage with. We take those numbers, pull them all together, and then produce a report for our community to use. That report tells you how many people are staying in emergency shelter, how many people are staying outdoors. I will say the process is not perfect because it would be impossible to make it a perfect thing, but we try to methodically go out and canvass the streets of Birmingham and the outside laying counties to talk and count every single person we can find. So I'll give you some official numbers, and then I'm going to give you a little sneak peek on some like numbers that are not official just yet. So our 2021 point in time count did take place in January. However, those numbers have not been finalized by HUD. But we do have final numbers from January 2020. They are not very useful right now because of COVID and how COVID has affected folks experiencing homelessness. We have more people experiencing unsheltered homelessness than we did before. But in January of 2020, on any given night, we had 848 people in the Birmingham area who were experiencing homelessness. 601 of those were staying in an emergency shelter. And then 247 were living outdoors or in places not meant for habitation, like abandoned buildings or their cars. So when COVID happened, many of our shelters had to reduce the number of people they can have in their building. And that was per CDC, social distancing, which is very difficult to do. And for a while there, our shelters had to reduce down to about 50% capacity. What that meant for Birmingham is that we lost 178 beds that were emergency shelter. So you can imagine if we did not have those beds available, those 178 more people might have been experiencing unsheltered homelessness at that time. Here's some unofficial numbers. So we feel confident in the number for the unsheltered count in January. So the number we have right now is 320 on any given night. That doesn't mean it includes every single person. Like I said, the count is not perfect, but is as perfect as we can be, right? So we believe on any given night in the Birmingham area, there's at least 320 people living outside. We are still working on the sheltered numbers. That gets a little bit more complicated. So we're not going to be able to even give an estimate of that until we get our data certified by HUD. But that's just a little peek into it. So we know that we have a quantifiable increase of folks experiencing unsheltered homelessness. We also know through anecdotally through our partner agencies and through our street outreach team that there are far more camps. Those camps are more established, so there are more people staying in each camp. So we are just trying to keep a snapshot of what's happening in our community. And these numbers, this data, not only do we have a requirement to give that to the federal government, which affects the funding that comes down to our community, but it also becomes a tool for our community to use to adjust what we're doing, or even just seeing, are we doing good or are we doing bad, right? So it helps us get that little temperature check on how things are going in our community. with that, I will wrap up in the next 60 seconds, I promise. But I want to give y'all something you can do, right? You can use your voice to enact power in different entities, right? So like I said, there's not any state funding that comes to address homelessness. So doing advocacy work, like calling your representative and saying, hey, why is this the case? Can you explain yourself? Or to keep tabs on different legislation like the Alabama Housing Trust Fund, which comes up every year, which would be a state source for affordable housing development, which would be really great. Just to echo what Carrie said before, affordable housing is a huge shortage in our community. A person making minimum wage has to work almost 2.5 jobs to afford a decent, safe, affordable housing in the private market in our area. So affordable housing, anytime that you can call your representative and say, this is a huge problem, we need to see something happen. If you check out One Roof's website, we typically post things that are happening in the legislature, so you can stay abreast of the different issues and bills that might be coming up. There's also a really cool organization, the Alabama Low Income Housing Coalition. They also do a lot of this work around advocacy in Montgomery as well. So stay active, pay attention to what's going on in our state, and just advocate for those that really need that affordable housing. Thanks so much.
Thank you so much. I am looking for questions in the chat box, or people can unmute themselves to ask directly. I was going to ask about increases in numbers with COVID just because of the economy, the number of people that lost their jobs. And I hear that it's unofficial, but obviously going up. Are there plans for vaccinations for the unhoused population? For COVID vaccinations?
So our shelter today, we vaccinated close to a little over 100 people today.
Wonderful.
And so we did that in partnership with the Jefferson County Health Department.
Mm-hmm.
And also we've been taking our folks over here to Parker High School. Mm-hmm. That's also a clinic site. So we've been getting the word out to our community. Yes.
That's great. Questions from others? I'm particularly intrigued about the lack of local and state dollars to address this issue. I had heard of the Housing Trust Fund. I'm not sure if I'm saying it exactly right, that it was a bill that was passed by our legislature, but they failed to fund it. Is that the
exactly correct? So in 2012, the Alabama Housing Trust Fund was established in law, but there's not a dedicated revenue source to go in it. For years now, ever since, we've had bills introduced. I don't think a single one of them has ever gotten out of committee, but there is a proposal for a slight tax increase on what you would pay to file a new mortgage. So if you buy a house or if you refinance your house, there's a filing fee that's already there. And I think it's like 5 cents per $100 or something like that of your mortgage. We were asking simply just to double that, and that extra nickel goes into the Housing Trust Fund, and it would raise millions of dollars every year. And that funding could be used towards either new construction or to rehab buildings for affordable housing, all sorts of stuff, even retrofitting existing housing so that we don't have to have blight or properties that go unused. It could have done so many different things, and it still can, right? So that I think the effort is still rolling there, but that's where it stands right now.
Is there a current bill proposing that in this session?
That is a good question that I'm not prepared.
Well, that's okay. I can do my own research. I can do my own research.
I hope that there is. It's just this legislative session has been so weird. So they
Yes.
met for just a short period of time and then took a break. And
Right.
I just don't
No,
know what might be on their agenda
That's
right
fine.
now.
we can look for that. Questions from others? Please feel free to unmute and ask. This has been a fabulous presentation. I know I've learned a lot.
Could you address briefly programs in the area for homelessness prevention? And full disclosure, I'm on the Bridge Ministries board, but I think a lot of people don't know about programs that try to keep people from being moved onto the street in the first place. And with the large number of people, we've got a moratorium on evictions, but the large number of people who haven't been able to pay their rent or their mortgages for a long time. What are we going to do about that when that bill comes due?
And I'd like to piggyback on that the moratorium is up at the end of this month and we've seen no action on extending it. We really need a state action to make sure it's effective here, and no one seems to be paying any attention to it in Montgomery.
Yeah, I mean, I can speak to this for just a little bit. So homeless prevention is a critical tool in our toolbox for ending homelessness as we know it today. Of course, we have folks that are currently experiencing homelessness. So we have programs dedicated to serving those, particularly those who are chronically homeless, are homeless for many years and have a disability. But Mary Lynn, you're absolutely right. So we should also focus on prevention, and Bridge Ministries is a really great organization that does that. We have some other partners in the One Roof Continuum of Care that do that as well. And Bridge is one of our partners, so we're very happy to have you guys. And you serve as a really critical tool right there. If there's a way to keep, oh, there's Lisa. Hi, Lisa. If there's a way we can keep people in their existing housing, of course, that's like the prime way to prevent, right? So if no one has the financial resources or the support system of friends and families to help them maintain that home, we definitely need those programs to pay the light bill or get it reconnected or to pay that back rent. The ESG program, the Emergency Solutions Grant Program through HUD, is a program that addresses just that. They do homeless prevention and also a program called Rapid Rehousing, which rapidly puts people back into housing after they've lost their house. So you're absolutely right. Those programs in our community are critical to the entire continuum of all the services we have.
Just in case anybody knows anybody who needs the help, you should know that there are very strict limits about who's eligible for that kind of help. And generally you can only help for so many months, but you can help pay back rent and rent going forward for people who have fallen behind with federal dollars.
But there's also,
oh, I'm sorry. Somebody was. I was just going to add real quickly, and I know Lisa Singer, you and I have talked about this at length. There's something going on that I know Gordon knows about, but you all may be able to do some advocacy around the CDC moratorium. Not only does it need to be extended, but a lot of the folks that we are working with don't understand what it means. They tend to think that it's just a blanket, I don't have to pay my rent. And of course, that's a good feeling, except that you do have to pay it. And you also have to be able to document that you lost your income somehow connected to COVID, and that you have tried all of the resources to get help to catch up. And that's a big gap right now, because people are having trouble proving that they're trying to get help. And if they had gotten help, they might not be sitting or standing in front of a judge saying, "Judge, I've tried." And we know there's money coming in for this, and there's lots of people working really hard on it, but we've got to have more people advocating for individuals and educating the good affordable housing providers. That's another missing link here, is we've got to get the word out to them that we'd really rather you not sue these folks and take them and try to evict them to get your money. We want you to help them access the programs that are available, not add on all those extra fees that they can't pay, and mostly, frankly, neither can we, and try to get them back on track with more of a team approach instead of everybody being adversarial all the time. Like, I've got to get this person out, I'll never get my money. And then of course they're desperately trying to get help. And then eventually, you know, you're going to end up in court. If not at the end of March, you will at some point. So we've really gotten a lot of help from the Birmingham Bar volunteers and legal services as well. But I think we need to connect rather a little more directly and try to catch folks before they get to that point. Because I know everybody's trying to not evict people. They'd rather not, but it's getting too far ahead. The curve is just really headed in the wrong direction, I'm afraid. So anything that your members could do to even talk with us, not, you know, in another meeting or in another setting about how we can make that happen, I think would be very helpful.
So the moratorium ends at the end of March, is that correct?
Yeah.
As
Okay.
far as I know, yeah.
And those of you who are working with folks in this situation, and this question may be impossible to answer, and if so, I'm going to apologize. Do we have I know there's a large number, but do we have a sense of how many people are facing eviction when that moratorium ends?
I don't have numbers of what's been filed in court. I can tell you just our one little agency with one person answering the phone for 4 hours in the morning, we're getting 15 to 20 people a day.
Okay.
Who are so far behind that without major help, they will not catch up. Even with stimulus and the help that's coming in, they have to have intervention really quickly, and their utilities as well. That's the other thing. People's utilities are being shut off now. So that's a big problem.
And the agency that you are with?
At Bridge Ministries.
Bridge. Okay. So you're with Bridge. Okay. Sorry.
Lisa's our executive director.
Yeah.
Gordon, do you have any numbers about kind of the pin-up problems?
I have numbers on number of folks seeking services every day. So our office also operates like a hotline service. If anyone's having a housing crisis, they can call our office, and we serve as problem solvers, trying to figure out what resources will work for them. So we get about, I would say probably 100 to 150 calls a day for rental assistance.
Wow.
And that's just the people who know about you.
Right.
How, this is Amy Alon, how much are you using the new money that's available? I mean, there was a call this afternoon about how to use that money that's now available through the rescue plan. My understanding is when we go in to do that, it's like a 27-page application. And then you have to upload a bunch of documents in order to be considered. So who's doing that here? And, you know, I mean, I work in a clinic and I'd love to be able to spend an hour doing a 27-page application and uploading their documents. But what about my next patient who has the same issue? So how are we spreading that around in terms of getting people help for that?
So, all right. So there are several different emergency funding sources coming into our community right now. Again, all federal. Amy, the one that you're referring to is through the Treasury. There is an allotment of money for rental assistance, and it went to the state of Alabama, it went to Jefferson County, and it went to the city of Birmingham. So each one of those entities got a slice of the pie, if you will. So the only one that's open right now is the statewide one, and it's the ERA, the Emergency Rental Assistance. It does have a lengthy application, unfortunately, but it is the only one that's open right now. Jefferson County and the city of Birmingham have not established a way to disperse that money just yet. Because of that, normally the state would not allow Jefferson County or Birmingham City residents apply for their money because those municipalities got their own piece of the pie. But since those two funds are not set up until the end of this month, City of Birmingham residents and Jefferson County residents can apply for the state money. So there is an expiration on their ability to do that. Hopefully the City of Birmingham and Jefferson County will have their program set up by then. Fingers crossed on that one. The other set of money that's coming through is designated through the CARES Act. And that is money that's coming through the Emergency Solutions Grant Program. And there are two entities in our area that receive that funding as well. Is Jefferson County and also the City of Birmingham. Jefferson County received about $2 million. That money has been contracted out through the Continuum of Care and dispersed into our partner agencies. So the Continuum of Care as a whole put an application out and were awarded the full amount of that emergency funding. And because of that, because of the collaborations and the coordination that we had with all of our agency, that money is available now. And part of that is for rental assistance through Homeless Prevention Fund, which Bridge Ministries does. It is also funding for things like emergency shelter, which both Val and Carrie have a grant for that as well. The other entity that received CARES Act funding was the City of Birmingham. Their community development department has not allocated or contracted that money just yet. But to more directly answer your question, Amy, I'm sorry, is places that can help people fill out those applications. At our office, we try to do what we can, particularly for folks who are living outdoors, to help them do, or who are at risk of losing their homes or being evicted. We try our best to help people do those applications. But what we've been able to do is partner with Community on the Rise, which is operated out of the Church of the Reconciler building. They have volunteer case managers that folks can make appointments with, and they have the time and ability to and capacity to sit down and help people fill out that application.
Amy, can I ask you what clinic you work with?
Yeah, I work at the PATH clinic at UAB. We work with low-income people who have no insurance, who are diabetic, and we get them their meds, and we help them with all kinds of social and behavioral issues that they might have. And I do work with Avery, and I really encourage anybody who is looking for a good place to donate is to donate to Community on the Rise. She does work getting people photo IDs, birth certificates, and she's basically using her funding to do that. And if you are thinking of a really good place to give, you can go to the site. I think she does Venmo or PayPal and make a donation. And it really, really does go directly to the people that she serves.
And I would add here that the Church of the Reconciler is going to start helping us register voters for people who come there and use their address.
Yeah, and to that same point that Amy was making, one of the barriers to people escaping homelessness is the inability to get a driver's license. And it's a very difficult and entrenched problem where folks have things on their record that they don't know how to clear up. And so my organization, Volunteer Lawyers Birmingham, tries to work with folks on that, but we've been limited by the jurisdictions that will help us. Usually we get a big chunk of people taken care of each year of Project Homeless Connect, but because we couldn't do that, we're right now looking into some other ways to help those folks. But once you get it all cleared up, you still usually have to pay the amount that's due to, and in a good situation, that's like $36 and change but for people who have to pay other fines and things first, it's even more of a problem. But until they get that ID or driver's license, it's very difficult to get a job. It's very difficult to get stable housing. So, and again, so people who donate to Community on the Rise, that's helping people with those problems, that's definitely a way that you can help people make a change in their lives.
Isn't there a bill at the legislature that the league is taking a stand on that relates to that?
There's a bill that we are taking a stand on that would prevent people from losing their driver's license because they owe fines and fees. It's a different problem. It's devastating when that happens, but that's House Bill 129. So, well, I want to offer any last comments. This has been a wonderful discussion, and I don't want to leave anybody out that needs to say anything else. I did post the Facebook page to Communities on the Rise, and then Bridge Ministries. If you have a website or some way, if you would post that for our folks.
Dana, if there is a moment, in addition to Church of the Reconciler through Communities on the Rise or whatever, offering opportunities for voters, for those who are being served there or anyone they can contact to offer help with voter registration, and particularly the steps beyond that, which are voting rights restoration, which Dana and others work so hard on. The Firehouse Shelter has done that for many years, and other shelters have welcomed voter registration if they are not serving those things themselves. And many of the sheltering services do include that as part of just one of the steps of, are you registered to vote? Is that, so just would like to credit other places and especially to appreciate that there are many factors and an ID, while you don't need it to register, you need it to go and vote.
Correct. Well, I want to thank everybody tonight. Leonette, did you have anything that you wanted to wrap us up with?
No, just want to thank the panelists for their
Fabulous.
insights and updates.
Thank you.
Yes, thank you so very much. Please note all the websites that are in the chat group and the comments here for those of you looking for a place to either volunteer or donate. I think we need to continue to keep a focus on this issue, and we're certainly ready to help. Please do reach out when there's legislation that we can help with, or any particular advocacy. I appreciate Nancy mentioning voting rights restoration. I have done that at the firehouse, but any of you on the call who are providers, if you have people that you interact with that think they can't vote because of a felony conviction, that might not be true, and I'm happy to come and meet with anybody to help them through that process. Okay, well, thanks to Val, to Carrie, and to Gordon, and thanks to all of you that came, and I hope to see you at our April meeting.